What's up, health informatics students? For this week's Monday lecture, we had a guest speaker who is a businessman and entrepreneur. Now, he was telling us that using informatics is important in gathering crucial data, but we must also take said data and use it to solve real-world applications. For example, we could gather data through informatics that may point out that students tend to be more stressed out in school and need a way to relieve said stress. But as discussed in Monday's lecture, it's one aspect to gather the data, and it's another completely different aspect to actually solve the problem. Now, there's many different solutions, and it's usually a high-risk, high-reward scenario. So we may reduce a student homework load, and that may work out and may not. Now, this is very similar to what we're doing in the hackathon, where we were given a problem and trying to solve it through different solutions.
The idea of entrepreneurship and maintaining one's intellectual property, or IP for short, is extremely important in the world of health informatics. The hackathon was a prime example of the need to utilize this. Sure, with the hackathon we were able to bring forth our ideas in a competition, but how many of us will truly follow up with our ideas and create a quality product for it? Faculty members from the UCI Cove, notably Mr. Odom Brown, spoke about the numerous features UCI had to offer for those wanting to follow up with their inventions made in the hackathon. I think it's impressive on the amount UCI is willing to spend on a potential student entrepreneur, as well as the resources they are given to ensure their success. As mentioned in an earlier lecture, the prototypes that we possibly can create is one step forward to creating an entire app, something that we can make potential millions of dollars with, and we need to take that step forward by taking a grant, for example, from UCI. The world of medical informatics can only thrive with more startups and young innovators to add to the growing list of inventions to help patient lives around the world.
So the article by Mike Milliard talks about some of the benefits and drawbacks to telehealth and how more and more healthcare providers are beginning to offer this technology. Telehealth is a use of information and communication technologies to access healthcare services remotely and manage your own health. The article supports the claim of the increased popularity of telehealth by citing statistics provided by HIMSS Media, where in the most recent 2019 report claimed that about 9 out of 10 healthcare organizations are offering or piloting telehealth programs. More and more healthcare providers are embracing telehealth because it can alleviate staffing issues and provide cost-effective care. I personally agree that telehealth technologies will only become more popular and even maybe be implemented nationwide. It will make healthcare more accessible and even improve the quality of care. However, I also believe that telehealth will bring on different problems with more accessibility. Medical care and consultation could potentially be overused, or it could even be used, or it could be abused to obtain prescription drugs.
Today, we're constantly trying to integrate the technology and healthcare systems for a more efficient care for the patients. One of the big reasons for this integration is to help patients to constantly care for themselves even at home. The information gathered during this self-care is then shared with the clinicians, which enables the clinic to provide a more personal care for the patients. Cystic fibrosis is a condition that requires a complex treatment, which is where the technology integration comes in to guide and encourage the patients throughout the treatment as well as ease the process. One example of technology that integrates with the health systems to help CF patients is an iPhone app. This can serve as a tool to help provide information, encourage treatment commitment, and even give quick and easy access to peer supports. Another example is a body-worn monitor. I believe that this is a very efficient tool since it can greatly improve the patient's daily routine, which will positively impact their health.
Technology can improve cystic fibrosis care through home-based and wearable technologies like using home spirometers and oxygen saturation meters, or even fitness trackers in order to actively monitor their health. This home-based self-care can help clinicians see trends or be able to compare month-to-month health records. Technology can also help patients pay more attention to their symptoms and keep track of them. It can also reduce the frequency of in-person clinic attendance for stable patients. The downside to this increased technology use is the chance of increasing the burden on CF patients at home by adding on to the other things that they have to do with their illness, which is why it is important to have an increased effort to reconfigure the distribution of care in order to reduce the burden in another aspect of the patient's routine. Another concern is negatively affecting clinical consultations from the data overload of the data collected in clinic as well as the data recorded daily by the patients. but this can also be avoided by emphasizing the importance of using summary data.